Intracompartmental pressure test is widely used by clinicians in order to diagnose acute exertional or chronic exertional compartment syndrome, which looks like this.
Oh, Jen, I don't know what's going on. Like, I'm having a lot of pain in my shin. I just got back from practice. It's hard to move my foot. And, like, it looks all waxy. I don't get it.
Or a traumatic compartment syndrome due to a direct blow.
Ah!
Individuals that are diagnosed with compartment syndrome usually have to undergo a fasciotomy, which is to help release the tissue and the pressure in the affected muscular compartment. Tests or reasons to get this test done include pain, redness, pain with passive stretching of the affected muscle, lack of a pulse, or paralysis radiating up or down the leg. So contraindications for this test include individuals that have to receive chemotherapy or radiotherapy after undergoing the fasciotomy, because it's imperative they don't undergo these procedures until the fasciotomy site has been fully closed. For patients that are suffering from chronic exertional compartment syndrome, the clinician usually brings them through a series of exercises, such as running or walking on a treadmill, and ankle dorsiflexion and plantar flexion exercises. Afterwards, both before, during, and after those procedures, their pressure levels in their compartment are assessed. Individuals that present with acute exertional compartment syndrome or traumatic compartment syndrome are immediately undergo the intracompartmental pressure test. So in order to perform this test, the clinician takes a slit catheter and inserts it through the skin and the fascia, or otherwise known as the tissue, at an angle of 45 degrees into the middle of the appropriate muscular compartment. Next, the clinician can use one of several pressure measurement techniques, but the most commonly used one is a slit catheter, in which the clinician cannulates the slit catheter, then primes it with a certain solution, and then inserts it into the affected compartment through another needle, which is connected to a recording system. Prior to performing this test, it is imperative that the physician takes the patient's blood pressure, specifically noting their diastolic blood pressure. As stated previously, a patient that is suspected of acute or chronic exertional compartment syndrome are placed through a series of exercises. Both before, during, and after the exercise, during the exercise, the physician will take the pressure measurements of the patient's compartment, and they compare it to the diastolic blood pressure. If pressure levels increase above 15 millimeters of mercury during a resting period, 30 millimeters of mercury 1 minute after exercise, or 20 millimeters of mercury 5 minutes after exercise, they are diagnosed with exertional compartment syndrome. Individuals that suffer traumatic compartment syndrome will generally present with a 30 millimeter of mercury differential pressure between the diastolic blood pressure and intracompartmental pressure.